These children run around town, overjoyed by the latest World Cup news. The reality in which these young boys live, however, is nothing to rejoice about. Along with the majority of Ethiopians, they do not have access to electricity or clean water. In these conditions, the ability to see will determine the boys' future ability to provide for themselves and their families. More than 6% of Ethiopia's population suffers from partial or complete blindness, and a shortage of eye doctors has dampened past efforts to alleviate the problem. A non-profit organization called Orbis, which uses a FedEx-sponsored DC-10 aircraft as a flying eye hospital, has come to the country's capital to educate medical personnel so that they can in turn offer better care to the local population. In the Menelik Hospital waiting room, people of all ages fill the seats eager to be selected for treatment. Amiro Nasur, a 10-year-old boy who has traveled 365 kilometers, is one of them. His right eye has been increasing in size for the past 4 years, and a CT scan has revealed that a benign tumor lies behind his bulging eye. Like many others, Amiro's long journey will not end as he had hoped. Although he has captured the hearts of the Orbis group, a number of factors convinced the team that surgery would be unfavorable. Dr. Kirsten explains.
He had good vision, and that any sort of surgery, even in the best of circumstances, was still likely to leave him with a significant likelihood of visual loss or double vision or inability to open his eye, etc. We didn't really feel like we had much to offer him right now. If he gets to the point where it loses vision or it can't close and becomes painful, etc., then they would probably end up doing an operation to remove the orbital contents, including the eyeball. So it's just something that we don't have a very good way to fix yet.
2 days later, 11-month-old Abush Lama wails as he and his mother wait to be called into the operating room. Several attempts by rural doctors to remove the lesion in his left eye have resulted in excessive swelling. This will result in permanent damage unless treated. Abush will not require surgery.
In his case, we did an injection of steroids right into the lesion. This patient we just held down. We just papoosed him, held his arms and head so he couldn't move, and injected him, and he didn't like it, and he shrieked for a few minutes, but he'll forget that.
While medical personnel at the Menelik Hospital stand by the operating doctor to observe the techniques used, up to 50 people can view an operation taking place aboard the Flying Eye Hospital. In both cases, those watching can ask questions while the operation unfolds. FedEx donations have allowed Orbis to establish a permanent country office in Ethiopia, giving rise to sustainable long-term programs in the countryside. At Bettina Clinic, 300 kilometers away from Addis, potential patients learn how to limit avoidable eye conditions. A poster that reads, "Clean face prevents trachoma," lurks outside the operating room where 2 patients are operated on by qualified nurses. Although this room appears primitive, it is a considerable leap forward compared to the infrastructure that was available only a few years ago. This man explains that before the clinic was established, he had to travel 7 hours in order to get help, and that the Bettina Clinic has improved his quality of life. Recently, FedEx has renewed its commitment as the primary financial supporter of the Orbis Flying Eye Hospital until 2011. We will continue to support programs such as the one in Ethiopia, train volunteer pilots, provide mechanical maintenance, and deliver medical supplies where Orbis needs it. Giving the children of Bettina truly something to rejoice about. For Inside the X, this is Véronique Leblanc, Addis Ababa, Ethiopia.